than ever, we want children and young people to be resilient. So we want them to be able to manage stress and cope with change and bounce back from difficult life experiences so that they can have positive outcomes. What we need to do to really build resilience and promote well-being is to build up protective factors and to decrease risk factors wherever we can. Our work has indicated that a key risk factor is loneliness. So we need to minimize the duration of loneliness wherever possible. For me, the key message is physical distancing doesn't have to mean social disconnection. We can keep in social contact even when we're physically distancing. As schools resume, I think we really need to prioritize a social and emotional catch-up as much as an academic catch-up. And reconnecting socially through play is really important. But also the academic expectations we set need to allow for this social and emotional catch-up. So we need to give messages to teachers and to young people and to parents that it's important to allow time for social and emotional catch-up. To build the protective factors, we need to promote well-being wherever we can. So schools and communities, but also nationally, sending out public health messages about activities that support well-being, like being physically active, socializing, doing enjoyable activities, having a daily structure and routine, for instance. And then for those young people who continue to struggle, we need to have that more targeted and individualized approach. So we need to make sure that children and families know who they can talk to if they're struggling and that there are this range of supports in place. So the lower ends of intensity, this might include kind of parent-led self-help approaches and computerized cognitive therapy-based programs. But we know that those kind of programs tend to work best if there's some kind of therapist input. So we need to ensure that that's in place. And at higher levels of intensity, we need to ensure that actually more specialist mental health services are prepared to deal with that increase in demand and that they can provide evidence-based treatments in a timely and accessible manner